this episode of Africa Health Check.
I definitely believe a bigger workforce needs to be given more room.
There is a huge gap when it comes to access, as the majority of us do not afford quality health care.
We explore the efforts and initiatives taken to promote sustainable health systems in Africa.
Smart is a 20-year-old ICT company that provides secure IT solutions that innovate and provide healthcare in terms of digitizing healthcare across the divide.
And the impact of innovations and local manufacturing on health outcomes.
Africa faces significant challenges in establishing sustainable health systems that are inclusive, resilient, and capable of addressing emerging threats. Global climate change and the COVID-19 pandemic have further exacerbated these barriers. On today's episode, we will be discussing sustainable health systems. I am your host, Khokhontlejang Paladi Morokotso, and I welcome you to Africa Health Check. I'm joined by our experts, Dr. Marianne Mureithi, the chair in the Department of Medical Microbiology and Immunology and a senior research fellow at the University of Nairobi in Kenya, as well as Reverend Anthony Achampong, who is a pharmacist and a pastor from Ghana. Before we get into that, let us have a look at this episode's feature story.
Smart is a 20-year-old ICT company that provides secure IT solutions that innovate and provide healthcare in terms of digitizing healthcare across the divide. We are currently in 11 African countries that span between Southern Africa, East Africa, and parts of West Africa. Technology, what I would say, is an enabler to healthcare innovation. And technology provides convenience to different community facets, beginning from the patients to the hospitals to the members. And what we have in terms of the Smart Access platform provides and speaks centrally into this particular convenience through innovation and technology. The Smart solution plays a very key role, beginning from the biometrics element of it, but it allows for only the bona fide members to be able to access healthcare and therefore provide a very easy way to access to healthcare and providing lower cost to the insured members as well as members accessing care. Two, in terms of provides for efficiency in what you're calling claim administration, where you can be able to now, with a smart system, have claims processed in a real-time basis and be able to remove the human element by embracing technology in adjudicating of claims all the way to be able to provide payments and therefore create the link between the payer and the provider. The first item I would say is the biometric element of the Smart biometric solution. One is to ensure that the biometrics element, it reduces the issue of identity theft, and therefore only the bona fide member can be able to access healthcare and therefore only access their allowed benefits. Two is in the elements of hospitals being able to only serve members up to their covered limits on the card. So as a patient, you're able to be covered up to your particular limits on your card or on your virtual access platform. For women leaders, one of the things is to be able to advocate for policy, because women are very keen to be able to drive in different perspectives from the policy level in advising policy makers to be able to include healthcare as a key agenda in running governments. When you come closer home in terms of the domestic, our homes, we have seen women being responsible for their children in terms of healthcare provision, being able to cascade down how do you provide first aid treatment at home, and therefore women play a very key role in the social change across the welfare of the healthcare divide. Literature, as we know, is very, very key. It provides for access to information. Where with available literature available, you're able to see and cascade down correct information on patient access as well as healthcare. So you're able to even change the health-seeking behavior of the community by providing accurate literature, as well as being able to ensure they're able to seek appropriate healthcare services across the board. I believe marketing is a very key ingredient to be able to cascade down the elements of healthcare. As one of the people who began from ICT, I would encourage all girls to be able to take up the STEM languages and be able to infuse marketing with other kind of technologies, for example, ICT, science, as well as the arts. And to also act as mentors to be able to inspire young girls and upcoming girls to be able to take up marketing in the technology space. And to be able to scale and across the healthcare space, we need to have partners and collaborators. In terms of collaboration, I look at being able to integrate different perspectives. We're working with different partners, organizations, and groups. We're able to merge different perspectives and therefore create awareness across board on healthcare and how to use IT to be able to enhance the healthcare provision. My parting shot is that healthcare is not only about ICT, it's about transforming lives through the people through ICT. I'll call upon all of us to be able to embrace technology in terms of creating and providing a positive change to be able to create a better health care tomorrow, today.
Thank you for joining us. You are watching Africa Health Check, and today we are discussing sustainable health. We are discussing climate change, and I'd like to welcome our experts here. I know that these topics closely resonate with both of you, and you've mentioned these throughout the entire season 3 of Africa Health Check. So maybe let me just start off here with you, Reverend. What have been the effects of climate change in our health systems in Africa?
Yes, climate change has become a top point, not only for developed countries, but also for developing countries in Africa. The concern is that climate change can precipitate people movement, migration from one place to the other, causing urbanization, overpopulation, also malnutrition, can cause drought, and all these things place burden on this little healthcare facilities, resources that are available. So if something is not done about it, then sustaining Africa health
is jeopardized. Absolutely. Do you want to add on to some of those effects that you've also witnessed as a researcher and as a medical practitioner?
Yes, thank you, Gigi, for having us once again. Always an honor. And climate change has become one of the most talked about topics in the world. I think we even have COP, the general conference, just that focuses only on climate change. Yes. And we see some policies being put that should mitigate us against the adverse effects. And really what climate change is, from what I see from these conferences and meetings, is the adverse effects of weather, the effects of these adverse effects of weather. And Gigi, in the last few years, we've seen quite interesting or very extreme weather patterns. Yes. For the first time, farmers do not know when to plant. Beforehand, when I was young, we knew between a certain month and a certain month.
It was predictable.
Yes, because the weather pattern was predictable. Yes. Now we don't have predictable weather patterns. So what does that mean? Our country will lack food.
Food security.
And without that food, it means many people will suffer from malnutrition, undernutrition. And then now with the little grains we have a problem that we call aflatoxins, where we don't know how to store these grains properly. And when we store them, a fungi, some type of fungi grows on top of it. And this fungi normally has a toxin. And this toxin has quite a huge effect on our health, from cancer to underdevelopment and so many others. And all this resonates or is attributed to climate change. Yes. With the adverse weather effects, we are seeing diseases that we've not seen before. For the first time, I read the other day, Texas is seeing malaria. Malaria was only being seen in Africa or in Asia. But this is because now mosquitoes have found a warmer climate where they can breed and cause this infection. So it's a wake-up call, Gigi, that we need to strengthen our healthcare systems, but also strengthen our systems to be climate resilient. Not just healthcare, Gigi, but also our food security, our general well-being. We need to be quite resilient and have ways to mitigate this adverse effect. Flooding is another effect of climate change. Flooding
Like in Malawi.
What comes after flooding? Typhoid. Because the sewerage system gets mixed up with the water system. And then we have a whole new problem, cholera, typhoid, name it. And this again affects everybody in the society, but the most vulnerable, the children, the young women. And all this again goes where? To climate change.
Mental health.
Yes.
New diseases. You know, even non-communicable diseases is still flare up, all due to climate change.
Absolutely. I think what you, as you've already said, you know, the case for climate change has already been made, especially during the COP conferences. I think we're at COP 27 now, the United Nations Climate Change Conference. We've seen many of our leaders go there. Commitments have been made. And most importantly, we are starting to feel the effects of climate change. We are starting to experience the adverse effects of what is happening around the world and how it is not only affecting our environment, but our livelihoods, the economy, and so on and so forth. So why is it that as it stands in Africa, it doesn't seem like climate change is high on the political agenda just as yet?
Well, I guess I'll tell you, we have many other problems. Okay, if not a new election coming, we have what do you call the coups? We've seen some few coups recently in West Africa, coup d'etats. We have political ambition,
instabilities.
In my country right now, we're talking about taking more loans to finance or cushion the government against many other things. But climate change is never on the table. But I think it's a wake-up call now for all of us to start raising our voices in terms of what are the effects of climate change. The other day, on national TV, our leader, our president came on TV saying there are people sleeping without food because, again, we've not had rains. And I felt so ashamed because I'm like, we are in the year 2023 and yet we do not know how to store our grains to mitigate such adverse weather effects. So we were now raising funds to feed these people. I think we can do better. I think we can start now thinking about, okay, this is climate change now. How do we plant? How do we have sustainable agriculture? How do we have sustainable healthcare that will look after these people who are lacking food? What can we do extra? How do we safeguard to make sure that these people, our populations, have clean water? I should not be at this day and age, flooding is affecting me getting clean water. So we have to build climate resilient systems. And to do that, we have to go back to the drawing board and see that we're strengthening ourselves right from the community level all the way to national levels.
Very interesting that you should say that. And I totally agree with you that one of the biggest challenges that we often face in Africa is competing priorities. We're always wondering, where should we focus? What should be our priority? Where should we be investing? Should we borrow more? Should we save lives? Should we feed them? Should we preserve them? And so on and so forth. And that also goes to show you that the challenges or the threats to our sustainability, and not just in the context of health, it's not just climate change. So maybe we could also just reflect on some of the major sustainability challenges that are faced by African countries.
Yes, Gigi, I think you hit the nail on the head. The priorities are our priorities. And for me, I feel one of the biggest challenges we face, we're not investing in people. We are investing in when the problem comes, we'll deal with it. But that's not the way to do things anymore in this world. We have to think through things and think about the future. And we have very good systems now that will help us predict what's coming up. But other challenges we have, I think, here in Africa is we have very good intentions. We'll have the funds if we needed to, but we do not have good governance. We do not have ways to monitor and evaluate our supply chains. The other day, we had a huge scandal in my country where we had all these medical supplies, again, through our global partnerships, given to Kenya. We went to the warehouses. Those supplies were not there. And now there's a huge investigation. Where did the mosquito nets go? Where did the ARVs, antiretroviral drugs go? Again, so we need
corruption,
good governance to avoid this
Yes,
corruption.
yeah.
So that again, we're investing in people and growing that trust, that confidence. I think we should start there because again, an empowered people will think outside the box.
Absolutely.
They'll be innovative.
Yeah.
They'll maybe do greenhouse agriculture so that we have food throughout the seasons. People will think through so many things. Using drones, using technology to predict weather patterns. You know, we have satellites in the skies that can help us tell us in the next few months there'll be rain.
Yeah.
So we need to empower people. Empowered people are very wealthy people. So I think that's what we need
I absolutely love that. I think if I'm hearing you correctly, you're saying that one of the things we get wrong is that we focus on building the resilience of the systems that are there, but instead of building the resilience of the people, because at the end of the day, systems are made to work by the people. So I think for the people, by the people. So I think that's a really, really powerful message. On the other side of this, I want us now to look into the future. What is it that we are asking Africans to do? We're watching Africa Health Check and we're telling them that we are faced with many of these challenges, but clearly there is something we can do. There has to be light at the end of the tunnel. So what is our message as we close off season 3 of Africa Health Check? But for now, we're going on a quick break where we'll hear what the people on the streets of Africa had to say. Stay tuned.
I rarely do see the youth being engaged in any activity. And if they are, you find that they are just on the back end. They are not really on the front championing. Whereas we know that we, as the youth, we have a firm voice. We have a voice that can be heard better by our own youth, by our fellow youth.
When it comes to diseases like polio, we have seen road shows being staged. We have seen also nurses going around communities and giving medicine to those who are under 5. So when it comes to awareness, I think for Zambia, I would give it a plus that at least we have quite a number of awareness.
I want to call all my people living in this country, in case anybody has a problem health-wise, that someone should go to the hospital for the treatment, for anything, not for those people who are sick and they are thinking of going to other places. So I want to call all the people, in case they are sick, they should go to the hospitals.
Welcome back. You're still watching Africa Health Check, and today we are talking about sustainable health systems in Africa. Just before the break, Dr. Marian, you're talking about some of the severe governance deficits that we have in Africa. And you know, it just reminded me of this other report I was reading, and it was saying that the total money that Africa loses to corruption annually is equivalent to the amount that Africa receives in aid. Meaning, without corruption, without economic crime, we actually would be self-sufficient. So in addition to that, what are some of the aspects of a sustainable healthcare system?
So it's very sad to hear that we are losing money every day, and we need to safeguard that. But one of the key aspects of a sustainable healthcare system is to, as like you said, good governance. We need good governance.
Yes.
We need good financial sustainability. Find ways to get the systems working and then working for themselves, for the people. We need accessible care. Accessibility is key. I need to be able to assure my population that they'll be able to access good care. A well-trained physician, midwife, etc. is key. And then access quality care. And this care is integrated, that whenever they visit a facility, they'll be able to either get vaccinated, get the surgical care if they need to. All those cases can be well articulated there. Other things is to have a very good supply chain. There's no point of building all these systems but lack drugs, lack equipment, lack other infrastructure that are essential for a sustainable healthcare system. And then encourage research, encourage innovation, encourage collaboration between both private partners or private sectors, governmental sectors, and other global partnerships. Because of that, we'll come up with very innovative ways ways to make sure our healthcare system is sustainable.
Absolutely.
Yes, I'll add, increased financing through community support, proper collaboration and partnership with local and overseas people, organizations, and then we taking ownership of our own destiny where health issues are concerned. So everybody is included in the drive. Everybody is called to play their part. Yes,
Yes, absolutely lovely. And as your parting shot, Reverend, I want you to speak to community leaders, because you are a community leader and you've done a lot of work in your community to improve the human and social development indicators. So I want you to make an appeal to a pastor, a chief, a community leader in a different sphere, to appeal to them about the important role that they play in nation building and in nation development, the important role they can play as an advocate for better public health outcomes.
In my background, there is the saying that nobody is a government. We, the people, are the government. So many a times when people say, the government will do this, the government will do that, the government will fix the road, they will do it. Actually, who is the government? The government is the people. So whether you are a Christian or non-Christian, you're a Muslim, or you are educated or uneducated, you live in the city or the rural, it's all of us that make the nation. So my plea with my fellow faith leaders and believers is that whatever you can do, whichever contribution you can make to develop a sustainable health system for all that delivers quality health for our lives, be part of it. Because the greatest gift of life is life itself.
Really, really profound. The greatest gift of life is life itself. Thank you very much for those motivating and very encouraging words. And do keep up the great work that you're doing in Ghana, Reverend. And now to come to you, Dr. Marian, your message to the people, and especially the young people, because I know they're very close to your heart as a fellow young at heart. Your message to them about also being agents of change and contributing to this transformation we want to see, the sustainable development that we want to see in Africa.
Yes, and it's quite a privilege to even give this parting shot, so thank you. And I want to start off by saying Africa, we are quite rich. Rich in resources, rich in heritage, rich in culture. And we need to be able to tie in all this together for the people, by the people. And I want to encourage all the young people. I know statistics may not look very good, particularly when you look at the young population. If not HIV, new HIV infections is other infections, from diarrhea to other non-communicable diseases that are now we're seeing in our young people. But I want to encourage you. We have the solutions at hand. We have the space to make up or to come up with innovations that will save lives and to save livelihoods. Do not wait for the government. Because again, as Reverend has said, you are the government, you are the people.
Yes.
If you see a problem within your home, within your community, be the solution leader.
Yes.
Come up with a solution and you'll be supported. Be the voice of change. Be the voice of reason.
Yes.
And throughout this program, we've also talked about looking after yourself. There's a lot of pressure to conform with the world, but also it's important to look after your well-being.
Yes.
If not, keeping fit, making sure that you're seeking help when you need to, because sometimes you're saying it's okay not to be okay. We cannot afford to lose one single person because of mental health challenges.
Absolutely.
We need each and every person to contribute to our sustainability, to our healthcare, and for us to emerge as leaders and future champions. My dream is to see Africa being the leading force, if not in pandemic preparedness, in pandemic response. Africa being the global leader in also financial sustainability and governance. I have a dream of an Africa that is so self-sustained that will be a model to the rest of the globe. And it starts with our youth. It starts with our next generation. And it starts with you.
Wow. Really, really powerful. Thank you so much for those very encouraging and motivating words, but also for being part of the show, sharing your knowledge, your experience, and all the wonderful work that you continue to do for Kenya and also for the young people that you work with. So please do keep up the great work. During the last episode of Africa Health Check of the last season 2, we had the CEO of AMREF giving his final message saying we should stop being nationals of our countries and be citizens of our countries. And he went on to say that nationals are people who carry identity cards to show that they belong in that country. But citizens are people who actually stand up and do something. They see problems, they become part of the solution. They're not just spectators, they're not beneficiaries, but they are part and parcel of the change that they want to see and securing the future that we want our children to live and thrive in. So please, I urge you one more time as we come to the end of season 3 of Africa Health Check, don't just be a national, be a citizen of your country. Before we wrap up our show today, let's highlight our African Health Champion for this episode.
Sophonia's Kifle Tesema is the driving force behind Africa's revolutionary approach to disease surveillance. As the program lead for pathogen genomics at the Africa Center for Disease Control and Prevention, he combines his deep-rooted passion for public health with cutting-edge technology to protect the continent. His role involves using advanced genomic sequencing techniques to detect and combat deadly pathogens before they become global threats. Just as a fire's early signs are spotted, he spots the genetic markers of potential outbreaks, enabling rapid responses. Growing up in a malaria-prone Ethiopian town, Sophonia's passion for public health was ignited by witnessing preventable suffering. Armed with a PhD in malaria genomics, he's a true local hero committed to advancing health outcomes across Africa.
And that brings us to the end of such a very powerful, inspiring, and thought-provoking episode. From my awesome Africa Health Check team and I give you a big thank you for tuning in. Remember to subscribe, like, share, and leave a comment on all our digital platforms so that you may form part of the stories that we highlight on this show. Do follow us on Facebook, Twitter, YouTube, LinkedIn, and Instagram. The handle is @Africa Health Check. We would be very happy to hear from you. Until we meet again, same time, same place, same date, remember the future is Africa. The future is today.